Hi, everyone. Welcome to Diabetes Primetime. Today, we're speaking with Dr. Victoria Bouhairie about type 2 diabetes and the role of diet, exercise, and stress management. Diabetes Primetime is brought to you by the new Relion Premier Blue Meter, which features a target range indicator that tells you at a glance if your blood sugar is high, low, or in range. Just click the link in the comments to learn more. Dr. Bouhairie, thank you so much for being here with us.
Definitely a pleasure.
So, you're a physician who focuses on lifestyle medicine. So, I'd like to start out by asking, what is lifestyle medicine and how can it help with managing type 2 diabetes?
Lifestyle medicine is a medical specialty that started in 2004. And what it focuses on is the use of six pillars: nutrition, exercise, social connections, stress management, substance abuse, and sleep in order to help you prevent and treat chronic disease.
So, Dr. Bouhairie, what are the key lifestyle factors that influence the development and progression of type 2 diabetes?
I mentioned that there are six pillars, and all of the six pillars are pretty much interconnected, is what we found. When it comes to nutrition, we know that type 2 diabetes is most significantly impacted by weight. If you lose weight, you're able to prevent the development of diabetes and also improve diabetes if you do have it. Within lifestyle medicine, we really advocate for a whole food, plant-based diet. And what that means is you're using really a low amount of processed food. Very little or really none is what we really advocate. So very little processed food, but really eating food in its natural state. So that could be fruits, vegetables, etc. Within the umbrella of nutrition, of course, there are various diets. The Mediterranean diet has been shown to decrease the risk of diabetes by 40%. And the Mediterranean diet consists of whole grains, nuts, fruits, vegetables. There is poly or unsaturated fats, and that's where you get in your fish, such as salmon and tuna, avocados. So that has been shown to decrease the risk of diabetes by 40%. Other great nutrition plans are, of course, your low carbohydrate diet, etc. So nutrition has a huge role when it comes to preventing diabetes and also the management of diabetes. The other pillar, which is sleep, also affects the development of diabetes. What we've seen and what is recommended currently is 7 to 8 hours of sleep for people who are between 19 and 64. And then above 64, from 65 and above, we recommend 7 to 9 hours. What we've seen is that if you have sleep deprivation, so less than 7 hours, you have an increased risk of both prediabetes and type 2 diabetes. So sleep is a huge issue when it comes to development of diabetes. Physical activity also, and as I mentioned, stress reduction, the increase in cortisol level will increase your blood sugars. And of course, you want to make sure that we're not using substances in order to manage our stress. So they're really all the pillars are interconnected when it comes to preventing diabetes and the management of diabetes.
Dr. Bouhairie, let's talk about the role of medication when it comes to type 2 diabetes and how our lifestyle choices can help the medicines we're taking be more effective.
That's a question I really get a lot from a lot of my patients. It comes hand in hand. With all the clinical trials that were done, which showed a benefit in terms of treatment of diabetes with medications, all of them had the foundation of lifestyle. You really have to combine the two. So, unfortunately, there it's not a quick fix. It's a process. If you have the foundation when it comes to making healthy choices, that's really going to help, number one, make the medication more effective, but also decrease the amount of medication that is needed.
I know some people feel like it's either or with medication. Either I'm addressing my health with lifestyle changes, I'm trying to eat healthy, I'm exercising, or I'm taking medication. Can you talk about how doing both can really support a person's health?
So it's really individualized. Some medications, such as the GLP-1s, they have heart and kidney benefit. So if you're somebody that already has some type of heart problems or have evidence of kidney disease, the medications have the added benefit of helping to prevent further heart problems and to help prevent the progression of kidney disease. If those complicating factors aren't present, then there's a possibility that you could just use lifestyle by itself in order to both prevent and maintain disease. Within lifestyle medicine, we have seen, and there have been many articles that have shown that there's disease remission. And what that means, for example, with diabetes, there have been some people that have been able to have an A1C of less than 6.5 for more than 3 months without medication. So we call that remission. So, and what I'll say is the number of people that are able to do that, again, is individualized. But if you have diabetes for a longer time, chances of you needing medication is more. And also, if you're able to adapt lifestyle changes earlier, that also makes it less likely that you'll need medication for a longer period of time. And if you do, with the lifestyle, you wouldn't need as much medication.
So, what I hear you saying is if the longer we've had diabetes, the more difficult it's going to be to get where we need to go with lifestyle changes alone. But making those lifestyle changes whenever we're diagnosed means that we may need less medication. Lifestyle is kind of a critical piece of this equation, no matter what.
Correct. There have been some patients who've had diabetes for a short period of time, adapted the lifestyle changes, and have been able to completely come off of medication and to maintain being off of medication, but the lifestyle factors have to come in. That's one thing that I would say is always the foundation in any treatment that we give.
Many more questions for you, Dr. Bouhairie, but we're going to pause here and do our trivia question. If you answer our question, folks, you will get our guide to the recommended serving sizes of fruit for people with diabetes. People with diabetes can definitely eat fruit. You just want to be sensible about how much, and this guide will help you figure that out. And you'll get it for free if you answer our trivia question, which is true or false, cucumbers are 96% water. Is that true or false? Are cucumbers 96% water? Put your best guess in the comments, and you'll get that guide to the healthy serving sizes of fruit delivered to your Facebook Messenger inbox. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So, Dr. Bouhairie, do you encourage your patients to check their blood sugar to see how their food choices are affecting them?
Of course, that's one of the foundations of behavior change when it comes to the treatment and management of diabetes. One really good benefit of that is you knowing what these food choices are doing to your body. And I always say that everybody is different, and what, for example, sweet potato would do to Sally may not do the same to Sue. But once you wear either a continuous glucose monitor or you use a finger stick to check your blood sugar, you're able to determine what this food does to you and your own health. So I think it's very vital information for you to have. It gives you the empowerment to know what your body, how your body responds to different foods. And also, if you're in the process of making behavior changes, it really helps with that too.
So, what can checking our blood sugar first thing in the morning tell us about what's happening with our diabetes?
So the blood sugar check first thing in the morning is called fasting blood sugars. And let me go back and explain some physiology or why this is even important. So in a fasting state, which is you're not eating, your liver produces blood sugar. And the blood sugar goes into different cells, and each organ basically pulls the blood sugar and uses it as needed. Your liver is supposed to be responsive to insulin, and insulin is supposed to direct the liver to tell the liver when to make more or not when it comes to blood sugar. So if you are eating, insulin is going to increase, your insulin levels will increase, and they'll tell your liver there's actually there's actually sugar in the bloodstream, therefore stop producing more sugar. When you become insulin resistant, the liver doesn't really listen to insulin as much. So what happens is the liver keeps on pumping out more sugar, even though insulin is present and is telling the liver to stop. So your fasting blood sugar really gives us an indication of what the liver is doing. And the higher it is, that means the higher your insulin resistance is. So sometimes my patients will say, I have not eaten anything, but yet my blood sugars are still high. And that's why it's the liver that's really cranking out the blood sugar, is cranking out sugar into the blood, and is not responsive to insulin.
I know there's significant evidence that supports the effectiveness of lifestyle interventions in diabetes. Tell us what the research shows.
One study that looked into this is the diabetes prevention program. And what they did is they took people, actually over 3,000 people were in this study. The participants were overweight and had pre-diabetes, so they're not yet diabetic. They had the early stages of diabetes. And they randomized these people, or they placed them into three separate groups. One was only lifestyle intervention. The other one was they took a medication called metformin, and then there was a placebo group. And what we wanted to see is what was the rate of progression from pre-diabetes to diabetes. And what they found after 4 years is that the group that had intensive lifestyle intervention had a 60% reduction from prediabetes to diabetes. The metformin group, which is the medication group, had a 30% reduction from prediabetes to diabetes. And this was huge because what it showed is that lifestyle intervention was able to double the risk reduction from prediabetes to diabetes.
So, if someone is listening to you speak and saying, okay, I really want to get serious about that, what is a good place for them to start in terms of making lifestyle changes?
So I would say start with heading to your provider, a healthcare provider, to really help you make these changes. Behavior change can be very difficult, and sometimes it can be overwhelming. So setting goals, prioritizing where these goals are, and really making things realistic for you. I always say when it comes to behavior changes, there's no right or wrong answer as long as you're heading in the right direction. And also, you don't want to feel overwhelmed. Sometimes people will make decisions, and those decisions actually don't end up heading the direction that they wanted it to go. And in those cases, we just come back to the drawing board and see how we can make things realistic for and more practical for you. But the big thing is small steps, right? So I mentioned six different pillars within nutrition, exercise, sleep. Where we start is really a decision that's made mutually, right? So I wouldn't come and say, we're going to start with sleep. No, we have a conversation. Where are you? What things matter to you most? How can we incorporate, for example, better sleep, or maybe better food choices into your day? It really becomes a decision that you would make, and the guidance should come from the provider, the person that's helping you. I also would say that it's really good to have peer support. And this can come in different forms. Sometimes it comes through coaches, sometimes it comes through different organizations. But the peer support is actually really, really helpful. There was a study that showed that people that are able to maintain weight had an accountability partner. So that peer group, that person that's able to say, you know, you're doing great, and let's continue to do it. So peer support is equally important along the way.
And is monitoring cholesterol levels and blood pressure levels over time as important as looking at our blood sugar numbers for people with diabetes?
Yes, so those are very important. Diabetes is a risk factor for heart disease. So we want to make sure that the other complications or the other things that can cause heart disease are well controlled. So blood pressure, we check that at every visit to make sure that your blood pressure is well controlled, and if not, then we start medication if you are already on the track of lifestyle changes. We also check cholesterol and making sure, the LDL is your bad cholesterol. So we really want the bad cholesterol to be low, and that good cholesterol, which is the HDL, we want that to be high. Sometimes we're able to attain that through lifestyle changes, but other times you need medications.
In case you're just joining us, we're here with Dr. Victoria Bouhairie talking about type 2 diabetes, diet, exercise, and stress management. We're giving away our wonderful guide to the recommended serving sizes of fruit for people with diabetes if you answer our trivia question, which is, true or false, cucumbers are 96% water. Is that true or false? Are cucumbers 96% water? Put your best guess in the comments and you'll get that guide delivered to your Facebook Messenger inbox. Dr. Bouhairie, in your view, how does our modern food environment make it more difficult to make healthy choices?
Oh boy. So I would tell you that this is something that we deal with on a daily basis. Unfortunately, processed food they have an excellent marketing campaign. If you go to the grocery stores, they look really, really good down in the aisle. If you're driving down the road, you'll see the fast food restaurants and all their advertisements, and it has an effect on not only us, but our children. So I would say that it's definitely something that we have to be very mindful about. We know processed foods increase the risk of disease. And also, if you do have type 2 diabetes and eat a lot of processed food, we know that that's going to make your diabetes worse. So we really have to make sure that we have measures in place where we're able to make healthy choices at all times.
Why is getting educated about diabetes and kind of learning the basics so important? How have you seen it help your patients?
I will use the word empowerment. I always ask my patients why, and that why is really the basis of a behavioral change. So if somebody has diabetes and they're coming to see me, and we really want to make sure that the diabetes is well controlled, I know why the person's diabetes should be well controlled. But I think it's very important that each individual who have diabetes or care for somebody who have diabetes also know that why. And the reason why that is important is because that in itself is the reason why somebody would make a behavior change. So empowering yourself and knowing exactly what diabetes is, knowing exactly what happens if your diabetes is not well controlled, knowing what complications can occur, knowing that if I make lifestyle changes, I can actually reduce medications, I can actually reduce the risk of side effects. Knowing that why is really the foundation of behavioral changes. And also knowing that is able to empower you to make good choices.
So, what I hear you saying is if we know why we're doing it, we want to be around for our grandkids, we want to have more energy, we want to, be able to sleep better. That makes it easier to do the tough work that is changing our habits.
Exactly, exactly. Knowing that why, establishing that why. Because when times get hard, it's the why that helps you through and to help you to stay on course. It's always that why. And I think everybody needs to know or needs to take time and really establish their why when it comes to their health.
So, what are some common misconceptions people have about the role of lifestyle changes in managing type 2 diabetes?
The first thing I'll say is that a lot of people think it's hard. And I'll say that behavior change is not easy. That is true. However, it's very doable. Some people feel like it is so hard that they would just not bother trying. And that's where we really have to change that mindset, really reframe that. People have made behavior changes. Some people are able to make it within months. Some people it takes years. And again, there's no wrong or right answer to that. It's really a matter of making a change in the right direction and working with somebody who's really a partner with you and to help you make that change when it comes to your health. So I would say people think it's difficult, but taking things one step at a time, giving yourself grace and really moving in a direction and moving in a way that actually works well for you.
So, you've mentioned stress management a couple of times as being very important for diabetes management over the long run. What are some of the tools that you work with your patients to use to help them get a handle on stress?
mindfulness is has been shown to really help decrease stress, meditation. And I have coaches, I have people that I work with in the community that are experts inside it. So my expertise is endocrinology and lifestyle medicine. But when it comes to mindfulness, that's when you bring somebody in that's actually an expert in the field. So it's really a matter of surrounding yourself with people who are experts in different areas of healthcare, and all of us coming together to partner with somebody with type 2 diabetes and helping and guiding them to the right direction when it comes to control of their diabetes. So if you're very stressed, from my standpoint, we discuss what those stress factors are, and my job is to help guide you and lead you to the appropriate resources in order to help manage that stress appropriately.
So I think probably folks watching at home are saying, okay, I get why food matters. I get why exercise matters. I even sort of understand why sleep matters. What impact does stress have on blood sugar or diabetes management long term?
One answer I would give is cortisol levels. So cortisol levels is a stress hormone. People that have increased stress have increased cortisol levels in their blood system, and that causes increased insulin resistance. So we really want to decrease the amount of cortisol that's present, which will subsequently decrease the amount of insulin and then decrease the amount of insulin resistance. But cortisol is a huge hormone that affects people whenever they have increased amount of stress.
So you're a lifestyle medicine physician. If someone watching is really enjoying your perspective and kind of your approach to diabetes management, how might they go about finding a physician near them who has a similar philosophy as you do?
The American College of Lifestyle Medicine, they have a website. You can just Google American College of Lifestyle Medicine, and you can find where you can put in your zip code and find all the board certified lifestyle medicine physicians around you.
Anything that we haven't covered that you want to make sure our audience knows about?
I really think to summarize, for type 2 diabetes, lifestyle changes is the foundation of both prevention and treatment of type 2 diabetes. I would say if big lifestyle changes need to be made, just give yourself grace. Set realistic goals, have somebody to help you, and also know that with lifestyle changes plus medication if needed, that there is a way in terms of preventing complications. So I would say start, just start somewhere. And the first step is finding a provider.
Dr. Bouhairie, thank you so much for joining us tonight. This has been a wonderful conversation.
Thank you for having me. It's been great.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, cucumbers are 96% water? The answer is true. If you didn't answer the trivia question, but you'd still like that super helpful guide for fruit, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.